introduce Dr. Sima Patel, and she will be speaking about epilepsy and the brain. Okay, so let me get this up here. Oh, there we go. All right, and Dr. Patel, come on up. I'm going to put my mask back on.
Now for the slides, can I also press this button?
So, yep. Yeah, so there's the little thing, and then you can, if you want to, you just turn this on, and then those arrows. And the green is a pointer, so there's arrows back or forth. There you go.
Great. Hi there. Thank you so much for this invite. This is such a cool program. I'm so excited to see so many young people who are interested in math and science. So my name is Sima Patel. I am an epilepsy doctor here at the University of Minnesota. I want to share a little bit of my journey with you. So I'll start with the earlier years, and I'll try to be quick in the 10 minutes. But I was born in India, and I came here when I was 3, so very much of the immigrant experience. I was raised in Chicago, and I went to high school at Lincoln Park High School. So much of my childhood is what laid the foundation for medicine. My parents were very sick when I was young, and I learned a lot about medicine through their illness. And that was a really powerful inspiration for me. And they actually ended up passing away when I was in high school, but that laid the foundation. Now, after high school, I went on to the University of Illinois in Urbana-Champaign, and I studied community health administration. I didn't want to take that typical science path because I knew I was going to study it a lot. And it was really when I started learning about chemistry and organic chemistry that I developed this strong interest in teaching. I really loved chemistry, and I started teaching as a teaching assistant to undergraduate students at a laboratory class and a science class, a normal didactic class for chemistry. And that's really where I started developing a passion for teaching and understood that power of taking something and transferring that knowledge. Now, you know, in the high school years, I was very introverted. I was really quiet and shy, and I didn't think I could be a doctor because people told me that, which was very interesting. And I realized that it's really about putting one foot in front of the other and creating your journey and listening to yourself and your experiences. And that's what I did. So doing that, I went on to, in my earlier years, I did something called AmeriCorps. It's a domestic Peace Corps, and it was amazing. I learned about advocacy, community-based community development, or asset-based community development. Obama actually taught us that because he was on the board for Public Allies, Michelle Obama and Barack Obama. So that was a very awesome privilege. And then I went on to Rush Medical School for 4 years and studied medicine. Then I went on to the Medical College of Wisconsin and studied neurology for 4 years, and then to the Cleveland Clinic Foundation for Surgical Epilepsy. Now that's, you know, a lot of years of schooling, but again, it goes back to that one foot in front of the other and just focusing on creating that journey. So now what I do is I spend a lot of my time teaching medical students, residents, epilepsy fellows, and also clinical medicine. I take care of patients with complicated epilepsy. And I also do research too on pharmacology of seizure drugs. So just personal interest, getting through sciences and having these kind of busy careers. My outlets are my 2 daughters. This is Anya and this is Arya. They teach me so much about life, and I continue to learn from them in a very positive way. And dancing. I love salsa dancing. It's a really great outlet for me. So, you know, why am I interested in the brain? The brain is amazing. We experience our reality what we see, what we feel, how we move through the brain. And when there is a seizure, for instance, that part of the brain is not working very good. So for instance, the frontal lobe, which is right here, so really the motor cortex, when the right side of the motor cortex has a seizure, the left side of the body is going to twitch. So when a patient comes to see us, they're telling their stories of their brain pathology for seizures. And seizures can show up in many different ways. Patients can lose awareness and stare off. They can feel panic or anxiety at a high level, and that can be a seizure, or a whole body convulsion. There are many, many different ways a seizure can show up. And often, if you have seen a patient have a seizure, it's really scary. It feels like they're going to get hurt, and many times they do. Now, epilepsy, it affects 1 in 26 Americans, around 3 million people in the United States, 65 million in the world. And it's a very expensive disease because it costs the healthcare system $15.5 billion a year. And around 50,000 people can die from it annually. So this is a disease that's difficult. We spend a lot of time on it. So what I do is I focus on the treatment, but I use these domains. So there's medications. So I talk about neuromodulation as pacing the brain as the topic, which is a new paradigm that's come up in the last few years, allowing us to do more for our patients. Epilepsy surgery and resective surgery. So when we talk about seizure meds, there's so many. There's like 30 seizure medications, and it becomes really hard to figure out what's going to work for our patients. I'm very interested in women and epilepsy and getting my female patients through a pregnancy on some of these meds. It's very hard. But the joy of seeing these young patients go on and have a family is such an honor and privilege. And so that's one part of it, is the medications. Now with epilepsy care, you're piecing a puzzle together. Another part of the puzzle is the brainwave study, the EEG. And the EEG allows us to record brainwave activity. Your brain is an electrical system. And what this looks like, so this is the left side of the brain, this is the right, and they're just wiggly little lines. And that's what I tell my patients too. So each of this, from 1 to here, that's 1 second, so this is real time, around 15 seconds. And the brain waves tell us a story too. And they're done by putting electrodes on the scalp like that. So you have the patient, how their seizure looks, then the EEG, and we use that data as we start working with patients, because sometimes in 20 to 30% of patients, medications don't work. You have to take it to the next level. And that next level involves understanding where the seizure's coming from. So you're mapping the brain out. Now, what I just showed you here are on the scalp, but this is literally inside the brain, right? You can see, and this is a patient who has a brain tumor that required electrodes on the brain to figure out where seizures are starting and where their motor function is, or eloquent cortex. So then we can decide how can we help this patient in the context of all of this stuff going on. So this is another way for the EEG for us to record the brain. And this is even yet another way, is electrodes into the brain. It looks pretty scary, but we have an awesome neurosurgery team, so they do a great job. And they put the electrodes in the brain because we're going back to the larger brain and saying, well, where are these seizures coming from? How do we map them out? and how do we piece this complex puzzle together. Now, after we put all these electrodes in the brain, we record the seizures, and then with all of this data, it's a lot of information, we try to piece together the puzzle and say the same question: where are the seizures coming from? And often what we can then end up doing after this huge workup with all of the pieces of the puzzle, the EEG, the brain wave study, the MRI, the seizure, how it's presenting, and so forth, we come up with an evaluation where we do the internal brain mapping. And then the phase after that, a group of us, an interdisciplinary team, that means there's neurosurgeons, epilepsy doctors, neuropsychologists, a group of us get together once a week and we talk about how can we help our patients and take it to the next level. And then this is a few more minutes on this. I think I'm okay on time. So resective surgery is when you actually take a part of the brain out. Temporal lobe resection can be very helpful for patients. Around 50% or more patients can become seizure-free. So this is a journey I take with my patients. Again, kind of going back to that analogy, step one foot in front of the other, and that's what we end up doing over years to build that trust and have them eventually, do something like a surgery, a resective surgery, for instance, that will help them become seizure-free. Now, other options in the last few years has been this concept of neuromodulation. There's a paradigm shift in epilepsy care where medications are always been helpful, but now we're looking at neuromodulatory devices to pace the brain. And one of the, in the last few years, there's been deep brain stimulation. And this is after we kind of do all of that work ahead of time, figuring out where seizures are coming from, and then we may decide to do this. It goes into the thalamus and provides a certain amount of current that breaks the seizure circuit up, okay? And patients wear the battery right here in their chest wall. Another device is called the responsive neurostimulation. So what this does is when a patient's having a seizure in real time, you program the device to pick up that seizure, and it delivers a current that you have programmed to stop the seizure. So over years, as you can imagine with this programming and neuromodulation, you're learning to pace the brain, okay? And then the third one is the vagus nerve stimulator that goes into the neck. Now, that's the end of my talk, kind of circling back to, the numbers of what we deal with in epilepsy. Now, I just want to wrap up before I take a few questions is, when all of these people were going to be here talking today to you guys, it seems like, wow, they've gone through all these years of schooling and we've done all this stuff. But if you can remember just one thing, one foot in front of the other, and you create your journey, okay? What questions can I answer for anyone about epilepsy or neuromodulation or anything? Yeah.
Where do you take the part of the brain out from?
The temporal lobe. So that picture I showed you earlier? Yeah, so that's the temporal lobe. So it's, I can't go back. But that's a temporal lobe resection. Now, you could find that you might do a resective surgery in another part of the brain also, but you really have to make sure that you're not going to leave the patient with a permanent neurological deficit where they can't function. So it goes back to mapping it out.
Why temporal lobe?
That's a good question. So if a patient has seizures and it's starting in the temporal lobe, doing a resection of that area or taking that out breaks that communication of brain cells. So that's one of the ways to do it. But now with pacing the brain, you can provide that electrical current because you're programming the devices in the network of seizures, and break the communication. So we're trying to disrupt that organized, synchronized electrical communication in the brain. That's a very good question. Anyone else? Well, thank you so much for listening. I really appreciate it.